Prof Kay gave me these fantastic hands, and the donor, obviously, and the donor family, and the whole team behind them. I'm so grateful, so lucky to have them. It's changed my life completely.
The hand is complex, they're extremely sensitive, they have fine control, very powerful control, but we use them in all sorts of ways. And I'm talking to you now with my hand moving to gesticulate and communicate, and they're always on view. So just as the face reflects a person's health and well-being and age and status, a hand does as well. You can tell whether somebody's ill or well, or married or single or old or young, just by looking at the hands.
I think the hardest part of the whole experience was the waiting. I waited so long for a match in the donor, and that was very frustrating, obviously. But after the event, I was quite ill, quite poorly, lots of infections, lots of drugs.
Hand transplants, surprisingly, are quite complex. First of all, you have to identify a person who needs a hand transplant, and you need to establish that they're suitable both from an immunological and behavioural point of view. Then they go onto our list, and we identify a donor through the remarkable work of the senior nurses in organ donation for NHSBT. We then bring the donor hands and the recipient together, and at that point the surgery starts, and the surgery is well worked out over many years because of our reattachment of amputated parts, but it begins with fixation of the bone to achieve stability, and then we repair by tissue the arteries, the blood, the veins, the muscles, the nerves, and then the skin. Well, the majority of people who lose one or both hands will be well served by hand prostheses, by artificial hands. But the limitation of artificial hands is that they are mechanical only. They're not warm, they're not human, they're not soft, they don't sweat, they don't feel. And if you can restore, if a patient is suitable for restoration of that full range of the behaviour and repertoire of the human hand, then you're restoring an enormous amount to that person for the rest of their life. They don't have to take them off, they don't have to put them on, they don't need a battery, they heal themselves. The name of the award is Who Cares Wins, and I feel somewhat fraudulent because I believe that every doctor cares and every nurse cares. We all care. So it feels very humbling. I'm very grateful to Corinne, but I accept it on behalf of the team with the proviso that I think everybody who works in healthcare cares.